So heart disease is a very general term. We tend to think mainly of coronary artery disease. The coronary arteries are the blood vessels that actually bring blood to the heart muscle itself, and those are the ones that are involved with a heart attack. Basically, when those blood vessels get blocked, the heart muscle doesn't have blood flow to itself, and then that heart tissue can die, and if it's not addressed, the patient can die. So in the way that we think of heart disease, we have to think of it as basically microvascular disease, meaning small blood vessel disease. And it mainly affects the heart. We mainly think about it affecting the heart because that's what is likely to be lethal for patients. But it's really a systemic disease, meaning you have tiny blood vessels in your entire body. So anything that causes those blood vessels to be damaged will cause heart disease and cause other problems in other parts of the body. So the risk factors for heart disease are basically the risk factors for vascular disease. Number 1 is smoking. Number 2, we talk about diabetes. 3, blood pressure. 4, cholesterol. And 5th is, well, family history, but that obviously you can't affect. Just generally exercise and weight loss, I would put as the 5th factor. So doing those things and working with a primary care physician or cardiologist to maximize the management of those factors will prevent heart disease, lower the risk of problems down the line, and also prevent the other issues associated with microvascular disease that people don't discuss as much. The number 1 that I see as a urologist is erectile dysfunction, which is essentially the same disease process as heart disease or coronary artery disease. It's artery disease of the tiny arteries that feed into the penis. So when those tiny blood vessels don't get adequate blood flow, then we can't have enough blood flow to cause an erection. So the same way, controlling smoking, diabetes, blood pressure, cholesterol, diet and exercise, those things will lower the risk of erectile dysfunction. For men who already have erectile dysfunction, it will reverse a certain extent of the erectile dysfunction and cure it in some cases. So that always has to be the number 1 most important thing for managing erectile dysfunction before we even talk about the pills, because this isn't just erectile health, this is your overall health. And if you die of heart disease, it doesn't matter how good your erections are. So for a lot of men who have heart disease, it may be a remote history. Maybe they had a heart attack 10 years ago, and since then they've gotten their risk factors under control, they've gotten their heart disease treated, but now they're still struggling with erectile dysfunction. These men can definitely take the medications for erectile dysfunction. The only caveat is the blood pressure medicines should not be taken at the same exact time as taking the erectile dysfunction medications, because that could drop your blood pressure too quickly. The erectile dysfunction medications are basically bad blood pressure medicines. They don't really treat your blood pressure well, and they have this side effect of causing erections. So you don't want to take 2 blood pressure medicines at the same time. So we say about 4 hours spaced out, which usually is not an issue for patients because they tend to take their blood pressure medicines in the morning and they tend to want to have their erections in the evening. So that's not typically an issue as long as the patient is aware of it. The one exception is patients who take nitrates for chest pain. Those are medicines that very quickly cause blood vessel dilation, and most patients take them kind of on an as-needed basis, meaning they're not scheduled. They take it when the pain develops. You never know when that's going to develop. So for those patients, I recommend that they not take erectile dysfunction medications, because we don't want to be in a situation where they just took a nitrate for chest pain, or they're about to take a nitrate for chest pain, and they also have this erectile dysfunction medication on board that could cause their blood pressure to drop. So for a lot of these patients who have heart disease, the pills are not adequate. They don't do the trick for them. We can talk about second line interventions like injections. If those don't work, penile implant is still on the table as sort of the gold standard last line of defense to restore erectile function in these patients. The main thing that we have to make sure of is that their risk factors are under control. So if you have heart disease because you have horribly controlled diabetes, we're not going to want to put an implant in you because that's going to be high risk for problems in the future. But as long as we can control all those risk factors as much as possible, and we've tried the other methods of treating erectile dysfunction, patients with heart disease can definitely get penile implants, and they have great success with them.